The following segment is sponsored by Citrin Cardiology. A heart attack can be a frightening, confusing, and stressful experience, but knowing the warning signs and what to do if you or someone you know is having a heart attack is extremely important. Joining us today to explain those signs and what to do is Dr. Ben Citrin with Citrin Cardiology, and we're so excited to have you in studio, Dr. Citrin. Thank you for coming in.
Thank you.
Okay, so let's start with the basics. Who is at risk for a heart attack?
Those who are at risk are people who have high blood pressure, smokers, diabetics, high cholesterol, and somebody who's had a family history of heart disease.
Okay, now that all makes sense to me, but what is happening during a heart attack?
Well, these are very small arteries, about 1/8 of an inch in diameter. They run on top of the heart, and when these blood vessels get plugged up with plaque and then blood clot that forms during a heart attack, blood flow gets obstructed to the heart muscle.
Wow, sounds super serious and extremely scary. So what are the classic signs that someone is having a heart attack, Dr. Citrin?
The classic signs would be chest pain, feels like a pressure, squeezing in the middle of the chest, may go into the arm, the jaw, associated with shortness of breath, nausea. Somebody might look real pale or blue in color.
Okay, these are all great things to sort of be aware of when it comes to having a heart attack. So can you break down the differences between maybe a male, a female, and then the elderly in regards to heart attacks?
Well, in the younger men, they tend to have the classic signs. That chest pain, we actually call that the Levine sign when somebody squeezes their fist and puts on top of their chest.
Okay.
Younger men tend to have that. Women tend to have more stomach symptoms. They may feel like it's reflux, indigestion. And then the elderly tend to have more shortness of breath, fatigue, may just feel weak and dizzy.
Okay, so say we're having some similar symptoms to these that you're describing. When do you start to seek attention or call a doctor?
Well, the key is to know your body and know when something's changed. And if you have suspicion that it could be the heart, that's when you seek attention. And that may be one of the reasons that women tend to do not quite as well as men because they wait longer to see a doctor.
Absolutely, because we try and control everything, I know from experience. So why is it important to act fast?
Because time is muscle. And as soon as that heart attack occurs, the heart muscle starts to die. And as quick as we can get it open, the quicker we can get it open, the better for the patient.
Absolutely. Well, thank you so much for this incredible insight. We enjoy speaking to you soon again.